All right, we're live.
All right. Good morning, everyone. It is February 9th, and this is the Senate Health and Welfare Committee. Thanks all for being here. We're continuing our work on, we're getting to the end of our work on S42, the Emergency Service Provider Wellness Commission. And Senator Hardy and I worked with with Katie McClinn, Ledge Counsel, over the weekend. So Katie has a new iteration of the bill. Why don't you put that up, Katie, and we'll go through it with you.
Okay, can you see a new draft?
Yes, terrific.
All right, so this is draft 2.1 of the Senate Health and Welfare Amendment to S42. And when we left, I believe it was on Friday, we had a conversation about how to incorporate the concept of diversity into the purposes of the bill. And if you remember, in subsection B, there's a list of, the bill as introduced had a list of 9 different purposes or tasks that the commission was going to be working on. And the amendment we looked at on Friday had a subdivision 10 that included the concepts of looking at or taking into consideration a person's gender or a person's race and ethnicity. The committee decided to expand the categories that were considered, but as we looked at this, it became clear that this was less of a new purpose for the commission to tackle, but kind of an overlay that all of the other purposes, or a lens that all of the other purposes could be looked at through. So instead of having it as a standalone subdivision, a standalone purpose, we've moved the language up into subsection B so that it kind of provides an overlay for all of the other purposes that follow it. So the language in this amendment is that there is created the Emergency Service Provider Wellness Commission within AHS that, in addition to the purposes listed below, shall consider the diversity of emergency service providers on the basis of gender, race, age, ethnicity, sexuality, disability status, and the unique needs of emergency service providers who have experienced trauma may have as a result of their identity status. So that is the new lead-in language to the purposes section.
Questions there. We should, why don't we pause for any questions? Sure. Any questions on that one? Just speak up because I can't see you all. Okay.
I think that makes a lot more sense.
Good. Yeah.
Than having it as a separate purpose. Yeah.
Okay.
Okay, great. I'll scroll down to subsection C. If you remember, subsection C was where we discussed who the members of the commission are. And the last draft you looked at had similar language to what had been subdivision 10, but it talked about including representation from different gender groups and different race and ethnicity groups. And again, the conversation was to expand the categories of representation. So the new language is that the commission shall comprise the following members and, to the extent feasible, include representation among members that reflects the gender, racial, age, ethnic, sexual, social, and disability status of emergency service providers in the state. And those are the 2 changes that have been made to this amendment since the last time the committee looked at it.
Okay, and we had a pretty good discussion about this whole area. So committee, questions for Katie on this? All right. Why don't we?
I don't have a question. I just want to, sorry, Senator Lyons. I just wanted to thank Katie because she and Ginny, or Senator Lyons, and I went around and around on this one. And so I appreciate that you were able to untangle us and get this language. So thanks.
She's good at that. We tangle and she uns. That's great. So here's my suggestion. And thank you for that comment, Senator Hardy. It's very well taken. Thank you, Katie. So why don't we go through the bill, and then we'll have one last discussion on the bill, and we can decide whether or not we're ready to vote today, or if you'd like to vote tomorrow or later today. So we have some choices. But Katie, why don't you walk us through the entire bill? Maybe put it back up again. We understanding that the yellow will be gone.
Sure. Okay, so the first subsection of the bill is a definition section. And if you remember, we spent some time looking at who the various professions are that fall into the category of an emergency service provider. And that conversation in part led to adding somebody who works as a 911 call taker to be added as a member of the committee. We'll look at that in a bit. And then we get to subsection B, which goes through the various purposes of the bill. We looked at the new language, the new overlay or lens that the other purposes are seen through. Would you like me to walk through each of these purposes, or are you looking for something a little more high level?
I think just a high level walkthrough on each purpose. It doesn't need to be, you don't need to read it.
Sure.
At this point.
Okay, so we have subdivision 1. We're looking at to identify where increased or alternative supports or strategic investments within the community, within the provider community, DA, SSA, or community service systems can improve physical and mental health outcomes, identifying how Vermont can increase capacity of qualified clinicians that treat emergency service providers. Subdivision 3 is the creation of materials and information, including a list of qualified clinicians that would be on a wellness resource center on the Department of Health's website. Subdivision 4 is to educate the public, emergency service providers, governments, emergency assistance programs, and policymakers about tools, practices, resources to prevent and intervene in the effects of trauma experienced by emergency service providers. Subdivision 5 is identifying gaps and strengths in Vermont's system of care. Subdivision 6 is recommending how peer supports and qualified clinician services can be delivered regionally or statewide. Subdivision 7 is recommending how to support emergency service providers in communities that are resource challenged. Subdivision 8, recommending policies and practices, training, legislation, rules, and services that will increase successful interventions and support providers, improve health outcomes, job performance, personal well-being, and reduce health risks. And then in subsection 9, consultation with federal, state, and municipal agencies, organizations, and entities and individuals in order to make any other recommendations to the commission as deemed appropriate. And I went so fast that I sort of skimmed over the addition in subdivision 5. So I'm just going to scroll back up because this is language that the committee specifically worked on. And this was the identifying gaps and strengths of Vermont system, not just for emergency service providers who have experienced trauma, but also the immediate family members to ensure access to resources for impacts on primary and secondary trauma. So I just wanted to make sure I highlighted that as you worked on it quite a bit on Friday and last week. That brings us to subsection C. And this is what we just went over, new language about representation and the membership of the committee. And here we have a lengthy list of commission members. And we have a new addition added by this committee. And that is subdivision X, the executive director of the Enhanced 911 Board or designee. And then we have language as to the length of term that members are going to serve, that commission members are to recuse themselves if they are familiar with a particular event, circumstance, or you can, an individual who is involved in an event or circumstance. Then we have language about when the Commissioner of Health or the Commissioner of Health's designee is to call the first meeting by September 30th of this year. The commission is to select a chair and vice chair from its members, and it can meet as such times as may reasonably necessary to carry out its duties, but at least once each calendar quarter. So it's meeting at least 4 times annually. And then we have the Department of Health as providing technical, legal, and administrative assistance to the commission. In subsection E, we have language about the meetings being open to the public. The commission can go into executive session in the event that a circumstance or an event involving a specific provider is described, even if that provider isn't identified by name. And then in subsection F, commission records describing a circumstance or an event involving a specific provider, again, regardless of whether that person is identified by name, are exempt from public exception under the Public Records Act. In subsection G, to the extent permitted under federal law, the commission may enter into agreements with agencies, organizations, and individuals to obtain otherwise confidential information. In subsection H, this is a reporting requirement that the commission shall report its conclusions and recommendations to the governor and General Assembly not less than once per year. And then just highlighting on line 19, this notwithstanding 2 VSA section 20D, this is refers to the 5-year review that the General Assembly does of reports. So this is exempt from the 5-year review. This report would continue on without 5-year review to see if it should be repealed, for example. And the language specifies that the report is not to disclose individually identifiable health information, or it is to disclose it only to the extent necessary to convey the commission's conclusions and recommendations, but those disclosures are limited to information already known to the public, and that the report is to be available through the Department of Health. That's it. The act takes effect on July 1, 2021. Oops, I think you're muted.
Yes, I was. Thank you. That was very good. Good review. So I guess, Katie, has anyone reached out to you with a request to, obviously the bill has been posted and this new iteration was just posted for today. So I'm thinking that if there are any folks who are out in the live stream world who would like to respond to changes in the bill, that we should give some time for that response. So committee thoughts on that? So what I'm thinking is, I don't like to do this. I don't want to prolong the discussion on the bill, but we could probably put it in very briefly tomorrow if you were otherwise ready to vote on the bill. Open for discussion. Yeah, go ahead, Senator Hardy and Senator Cummings.
Oh, okay. I think we've talked about the language quite a bit, and we've sort of moved it around a little bit, but the gist is what we've discussed for the last week and a half. So I'm just, all this is to say I'm ready to vote today if the committee's ready. But if you want to wait till tomorrow, that's fine too.
Okay. Senator Cummings, did you want to add anything? Anyone else have an opinion on that? I think I'd like to hold over. I know I do that for the committee on a regular basis. This is the first time we've seen the language, even though, as Senator Hardy said, we absolutely have talked about this and we understand the implications. I think it's great. I think it improves the bill radically. So let's plan on a vote tomorrow. So be prepared to do that. And our clerk will be prepared to do that. We'll just need a motion tomorrow. I don't know what time, but we'll do it maybe before we start looking at either the flexibility bill or anything else. How's that? That'll be good. And I do appreciate what you said, Senator Hardy, and so I've kind of learned to err on the side of caution, regardless of how well we've gone through the bill. You never know what people out there might be hankering to say. So Okay.
Does
All
Katie?
right.
Does
Yeah,
Katie?
go ahead.
I do. I just wanted to let you know I won't be available to the committee tomorrow, but you don't need me to vote.
Hope not. If we hear anything before tomorrow, then, we'll sort that out. Okay, thanks for that. Okay. That's good. I can't believe it. There we are. We've finished our discussion. So we have a meeting at 10:30 with Senate Natural Resources on PCBs and chemicals of concern. This generated by the identification of polychlorinated biphenyls in the Burlington High School, and then an interest in what that means for other schools or buildings in our state. So we're going to quickly adjourn, and then no, we're just leaving this part of the committee, and then Nellie has sent out a separate Zoom to log into the Natural Resources Committee just a couple minutes before 10:30. I don't know where they are in their schedule. So anybody have anything else they want to bring up?
Quickly before folks leave, just to make sure folks understand where we're going to be in the Zoom world, after Senate Natural Resources wraps up, we will come back to this Zoom room that you got information for before.
That's at 11:15. Thanks, Nellie. Okay. All right.
All right. See
Thank you all. See you in a few minutes.